Okay, the skull then are all the bones of the head, and then these that protect the brain are the cranium, so all these bones up here are the cranial bones, and these here that are the facial bones. Okay, and there are solid joints which now are called sutures. There's a solid joint which is called sutures. Now of the cranial bones, this bone right up here in the front is the frontal bone. The area right above the eye then is the supraorbital margin, and in there then there is a foramen, which is the supraorbital foramen. Okay, and then within the bone there are spaces, and that spaces within the bone then are called a sinus, and up here then would be a frontal sinus. The bone here on top of the skull is then the parietal bone, and when you look on the inside of the bones, then there are going to be eminences. Eminences are then which ties then to the meninges, and then there are also depressions, and here's a better shot of depressions. Depressions then would be where there are blood vessels, and then there could be some nerves in these depressions. So these are eminences and then depressions. Okay, where are we at? The temporal bone. Where are we at? We're at the temporal bone. The temporal bone is here on the side of the skull, and in the temporal bone there is a process right here, which is the zygomatic process of the temporal bone. The petraeus portion is the portion here that houses the middle and inner ear, and this then is our hardest portion of the skull, or the hardest bone in the body. The carotid arteries go then to the brain, and these openings here then are for the carotids. They're a little bit more anterior, and they are smaller than the jugulars. These are the jugular, and the jugular is the jugular coming from the brain. That's carotids go to the brain. These are from the brain, and they're physically bigger and more posterior, the jugular foramens. This then is the mandibular fossa, and this then is the point of attachment for the lower jaw, and right in front of it is the articular tubercle, and so ligaments will tie the lower jaw to the upper jaw. So that's point of attachment to the ligaments, tying in the mandible to the maxilla. The opening or the big bump behind the ear here then is the mastoid process. This ties into the big muscles on the side of our neck. Right in front of it is the styloid process, which then attaches then to the tongue and to the hyoid bone. This then is the external auditory meatus, which goes then from the outer ear to the middle ear. And on the inside here is the internal acoustical meatus, which is coming then from the inner ear and going to the temporal lobe of the brain. The bone on the back here then is the occipital bone, and in the occipital bone, the large opening here is the foramen magnum, which then where the spinal cord is going to come out from the brain. Right in front of it is the occipital condyles, and these attach then to the number 1 vertebra, the atlas of the vertebral column. The bone here that is red now, then this is the sphenoid bone. This is our keystone bone of the skull. There is spaces within which are called the sphenoid sinuses. The very center right here is the body of the sphenoid, and the depression in that then is the sella turcica, which houses the pituitary gland. The greater wings are larger, and they are more posterior and inferior. The lesser wings are smaller physically, and they are superior and anterior. The orbit of the eye is made up of 7 different bones, and this then will house the eyeball. In the back of it on the medial side is a foramen, and that foramen then is the optic foramen for the optic nerve. And then there is a little bit of a triangular slit, a little bit below and lateral. And this then would be for the cranial nerves. Cranial nerves 3, 4, 5, and 6 come out of that slit. On the lateral side of the lateral posterior part of the nasal cavity are the Petrous process, and so these then are the Petrous process. The smallest and weakest bone is the ethmoid bone, and also there are ethmoid sinuses in that ethmoid. When you go down into the nasal cavity, part of the ethmoid then is the perpendicular plate, and that will be part of the nasal septum. The cribriform plate is the horizontal part of the ethmoid, and the crista galli then is the vertical part of that ethmoid bone. And in there are all kinds of little tiny openings, and these are the olfactory foramina. Those are openings then for the olfactory nerves. Now inside the nose, also part of the ethmoid will be conchas, and these are coils of bones for causing air to swirl, to moisten, warm, and clean the air. And there is the superior nasal concha and then the middle nasal concha. The nasal bone is just this upper 1/3 of the nose, helping form the nasal cavity. The upper jaw now is then the maxilla, and there are sinuses within it, which are the maxillary sinuses. There are alveolar processes which will house the teeth. Okay, and so I think we can see some on some of these. So these would be alveolar processes which will house the teeth. And the roots of the teeth will go in those alveolar processes. Now, to separate the oral cavity from the nasal cavity then is the palatine process, and so that would be the roof of the mouth. And the anterior portion is a nerve called the incisive fossa. Now below the eye then there is another foramen, which is the infraorbital foramen. Our cheekbone then is the zygomatic bone, and then there is also then the zygomatic, or the temporal process of the zygomatic bone that helps form that zygomatic arch. On the corner of the eye on the medial side is a very small bone, which is called the lacrimal bone. That's the smallest bone here of the body. And then there is a lacrimal fossa, which is called then our tear duct. The mandible is then the lower jaw, and in the lower jaw, the horizontal part right here then is the body. The vertical part is the ramus, and the portion right between then is the angle. And in the front then there is a foramen, which is called then the mental foramen. And where are we at? Okay, and then the attaching then to the mandible is the condylar process, and this will articulate to the mandible and to the mandibular fossa. In front of that is the coronoid process, and that will tie into the temporal muscle. And then between the two there is the mandibular notch. And then on the medial side there is then the mandibular foramen, and so this will be the foramen here on the medial side. Also they have, again, for the teeth, they got the alveolar processes for the teeth. Now, in addition to the superior and middle conchas, there is an inferior concha which is separate, and that is the lower concha of the nasal cavity, and that's a separate bone. Also in the bottom is a triangular, which is the vomer, and the vomer and the perpendicular plate to the ethmoid will make then the nasal septum. Now we have 4 major sutures, a suture that is going across the body, between the frontal bone and the parietal bones, is then the coronal suture. Between the two palatines is the sagittal suture. Going between the palatine and the occipital bone is then the lambdoidal suture. And going between the palatine and the temporal bone is the squamosal suture. Now, in our baby, we also have the fontanelles, and these are soft spots for birth and for growth. And so this end is the anterior or frontal fontanelle. On the opposite side would be the posterior or occipital fontanelle. And then on the anterior lateral side is anterior lateral or sphenoidal fontanelle. And then on the posterior side is the posterior lateral or mastoidal fontanelle. Now, in some individuals, like here in this baby, there is an additional little bone which are then called the wormium bones. And there is then also the palatine suture, which runs right down the middle of the palatine process. That's it.
He's a rock star.